So on the health side of things, if someone is having some kind of psycho-spiritual turbulent experience and they went to a psychiatrist, or maybe they were sent to an emergency room, well, how would they likely be diagnosed now?
So your diagnostic options are very limited. If it's related to a psychedelic, they might just say, this is psychedelic, this is intoxication from a psychedelic, and maybe give them a benzo and or an antipsychotic and let them sleep it off. And hopefully they have a family and hopefully they have no residual stuff, right? Because as you know, sometimes people take a psychedelic, they go up, they are weird, they come down, they are not. And they go about their lives and not much has changed, right? There are plenty of people who have partied plenty of times with psychedelics and they didn't have a massive existential transformation or any profound benefits or challenges, right? This is a thing. But sometimes, as we both know, people go up, they come down, but where they land is really, really different from where they were a few days ago. And that different might go on for hours, days, weeks, months, years, the rest of their lives. And that different might in the short, medium, and long term be either for each one better or worse. It might be way worse, as you know, and that's the important work that you do. It might be way better, right? They might have massive healings and transformations, as the Johns Hopkins continues to point out about psilocybin and cancer and stuff, right? And anxiety and depression, or, MAPS, and they continue to point out about MDMA and trauma. But I also know people who took some MDMA, went way up into a peak experience, and then crashed hard into dark night stuff. So I also think it can facilitate this insight cycle, which can be very, very nonlinear and confusing, in which case they get diagnosed with bipolar or bipolar 2 or bipolar 2 rapid cycling, which is a diagnosis that basically says you're broken for life. You'll be on meds for the rest of your life. It's just going to get worse unless we control it with meds. There's no beneficial anything out of this, except reluctantly acknowledge that when people are quote unquote manic, they may be somewhat more creative, but also more prone to risky behavior and wrecking their lives and driving everybody crazy. And but the appreciation of the potential transformative side is very limited. And then the problem is a lot of these diagnoses carry the notion that you are messed up forever. And that story, as we've noticed in psychedelics, right? So as Chris Timmerman's research shows, what the shaman or the psychedelic trip sitter or whatever says to you in or shortly after a trip, there's a neuroplasticity and a receptivity to messaging. If you put into that receptive state, you are now broken for life and will need meds for the rest of your life and have a stigmatizing diagnosis that might ruin your career and make you unhireable or uninsurable if you're in a barbaric country that your insurance is determined by your previous medical conditions and stuff, like the United States. Then this can be an absolutely catastrophic experience and really detrimental to an entire person's sense of identity, of what, and totally potentially divorce them from any potential healing or transformative potential that might be happening in this nonlinear process. Not that bipolar in I think its classic form doesn't exist. I actually do think it exists as a thing. I've seen it. I have friends that I think have it. They don't describe any insights, no transformative stuff. They just get a lot of energy and do damaging things, and then they get really sad and do damaging things, right? So there doesn't seem to be any obvious benefit to them from this. And then you've got people who may have both, right? This is where it gets really confusing. And how do you sort this out? They have maybe insight cycles and they have classic bipolar, and sometimes these do interesting things with each other. And then what do you do with that, right? Some mix of meds and meditative practices to participate, to facilitate the transformative healing or something or whatever. Like this is going to take a lot of science to sort out. I don't have the right answers. I can simply identify that I think there is a Venn diagram of overlap of what I personally think, based on my limited skewed case series and biases, are two related but somewhat different things. But almost certainly are going to involve some of the same brain pathways. I would be amazed if they didn't. And
I think that's really interesting. Yeah, go on.
Yeah, and then you've got things like you might be diagnosed as psychotic, which is not helpful. That's a purely pathologizing diagnosis. And maybe the angels you saw that restructured your DNA and healed you of your trauma, you now have a label in a vulnerable state that you were told that was purely pathology. You were simply crazy and there was nothing redeeming about that experience at all, which can set up these weird internal conflicts when a part of you goes, wow, but I really felt healed, but maybe that was all crazy and there's no validity in my healing. Well, that's not something you want to do as a clinician, right? To totally invalidate something that was really beneficial for somebody. That's not your job, hopefully. And so, or as any kind of facilitator or provider or just friend, right? you hopefully are not doing anything like that. And so, and the best you can hope for is adjustment disorder, which is adjustment disorder is sort of this catch-all category of you had something you needed to adjust to and you're having trouble adjusting to it. It's the most benign and less pathologizing of all of the, diagnostic categories you're likely to get out of the DSM that don't involve psychosis or bipolar or delusions or hallucinations or drug use problems or whatever. So, but that still is very unsatisfying to those of us who have seen vastly more sophisticated maps that really seem not only predictive and descriptive, but also prescriptive in terms of how to do something useful with those experiences. So I think the best of the maps, again, not only describe and normalize and predict what will happen next and predict maybe even what came before, but also have the sense of potential that you can take whatever's going on with you, and for thousands and thousands of years, countless people have figured out cool things you can do with your mind that allow you to work skillfully with each of these phases of practice and attain some sort of benefit from it on average.